Good afternoon. This is our team at Madhukar Rainbow Children's Hospital. I am Dr. Sarath Goapalan. I am a pediatric gastroenterologist and liver specialist at the hospital. With me is Dr. Chandershekhar, who is a senior intensivist. He is the head of pediatric ICU, our main pediatric surgeon, Dr. Chandroday, and Dr. Hari is part of the intensive care team. Today, we are just briefing you about a very unusual situation we faced in our hospital, where we had a 12-year-old boy who had come to us not being able to pass stool, not being able to go to the toilet, motion, for 3 weeks. He had already been to 2 hospitals and all attempts had been made to evacuate his bowel and wash out his stool, but this did not work. So he came with the complaints of not being able to pass stool for 3 weeks. He was feeling bloated. The abdomen was feeling uncomfortable. He was having pain on the left side of the abdomen. And on 3 or 4 occasions at least, he had vomited out whatever food he had taken. With this background, we decided to admit him in the pediatric intensive care unit. We fasted him for 24 hours, did not allow him to eat or drink anything. We started him on intravenous fluids, and systematically our pediatric surgeon, Dr. Chandroday, decompressed his rectum through a flatus tube, a rubber tube, which was passed into the anus, and gradually the stool was evacuated. An attempt was made to slowly evacuate and collapse the rectum so that the distension of the bloating of the abdomen could be minimized a bit. Along with this, we started by mouth the tablet of erythromycin. You must have heard of erythromycin, an antibiotic, which is given sometimes for bad throat and fever. The same antibiotic, when given in a much lower dose, has been shown to cause the bowels to start moving. And when we started this treatment, within 36 hours, he started passing gas, and then he also started passing his motions. And we have now continued the tablet for nearly a week, and he's passing motion normally. He's free of all complaints, and he's like any other normal boy. The intensive care admission was absolutely necessary because he had been kept fasting, and in the initial stages, his abdomen was bloated and he needed monitoring with expert intensive care support. Fortunately, he did not need more advanced intervention with other intravenous drugs which could have had more side effects or any risks. So as a team, we have been very, very happy that this outcome was there within less than 3 days. And considering that he has missed school for more than 3 weeks, we know how to manage this situation subsequently. This condition is called colonic pseudo-obstruction. It's called pseudo-obstruction because with all investigations which you do, you will find that there's nothing actually obstructing or blocking the passage of stool. There's no mass, there's no tumor, there's nothing there. But still, the intestines go to sleep. Hence, it's called pseudo-obstruction. All your investigations are normal. This condition is extremely rare at all ages. This colonic pseudo-obstruction is also called Ogilvie syndrome, named after the person who first discovered this in the West. And it's more common in elderly beyond 60 years of age, and in children it's even more rare. It's extremely uncommon. So the few case reports which are available about this condition, one of the treatments which has been tried has been this erythromycin approach. And we tried it and it has worked very well in his case, and it's been quite comfortable. So with this background, I would invite Sambhav himself and his parents to say a few words about what they went through, their frame of mind, and how they feel today after this entire treatment has been completed, and his relief of symptoms is complete.
मेरा नाम संभव खन्ना है और मैं 8th क्लास में पढ़ता हूँ। मेरी एज 12 ईयर्स है। 6 जुलाई को मेरे को मोशन पास नहीं हुआ, मुझे प्रॉब्लम समझ में नहीं आई और उस दिन मेरे को वॉमिटिंग भी हुई। उसके बाद मैंने काफ़ी हॉस्पिटल्स में दिखाया लेकिन किसी को कुछ समझ में नहीं आया। हम 2 हॉस्पिटल्स में एडमिट भी हुए लेकिन किसी को कुछ समझ में नहीं आया। उसके बाद हमने डॉक्टर सरथ गोपालन को दिखाया, जो एक गैस्ट्रोएंटरोलॉजिस्ट हैं। उनके हॉस्पिटल में हमने एडमिट कराया कि सूडो ऑब्स्ट्रक्शन की वजह से। उन्होंने मेरा ट्रीटमेंट किया और मैं अब बहुत ज़्यादा बेटर हूँ। थैंक यू टू मधुकर एंड चिल्ड्रंस हॉस्पिटल।
मेरा नाम मनीष खन्ना है। आई एम मनीष खन्ना, फादर ऑफ संभव खन्ना. The period, the 3 weeks which Mr. Gopalan has talked about, it was very pressurous and nobody is able to understand about the problem he is going through. Thanks for Dr. Ripan who has given me the number of Mr. Gopalan, and he has convinced me to admit into the hospital, and at the very first meeting he diagnoses the problem without seeing any report and everything. And thanks sir, thank you very much.
And it's a team effort. Dr. Chandroday, Dr. Chandershekhar, Dr. Hari, the entire pediatric intensive
I'm
care
thankful
team
to all of each
as
of
a team. We have worked and we are very happy that
we are very happy.
with
And we are
minimal,
thankful to you.
in a simple way, we have been able to achieve this result within 3 days.
Thank you sir. Thank you very much.
We have anticipated many things considering the prolonged history of, it's not passing in almost for 3 weeks. If somebody haven't passed stool for more than 3 weeks, there could be lots of many complications. There is peritonitis, it means infection in the abdomen. There could be vomiting of the fecal, it means sometimes they vomit the stool also. So this is very dangerous situation, and it could be some sort of life-threatening situation. And we are very fortunate, and the Sambhav is responded very nicely with the medication we have given, the erythromycin. So actually we are very happy. Now today is going home.
Dr. Chandroday, have you seen this commonly in the surgical setting?
It is actually seen in the older age people, but it was extremely rare, and I haven't seen this problem in any children till my experience of 7 years. So it was quite unusual to have this disorder in a pediatric age group.
In fact, I agree with you. In almost 30 years now of my pediatric gastro practice, the last time I saw this is only the second time I'm seeing this situation. The last time was when I was a student myself. I just finished my training period, and at that time I saw my first case more than 25 years ago. This is the second time I'm seeing it now. So it is really a rare condition.
So I think that time it was not known actually.
It was not even known.
Erythromycin
Exactly.
is a
And this treatment was unknown at that time, using erythromycin 25 years ago.